Hello, everybody. Welcome back. So, remember when we talked about the bladder, I mentioned that a lot of people might have had surgeries, both women and men, around the pelvic area. So, and of course, the pelvis is not the only place where we had surgeries. I have worked with people who've had multiple surgeries, 5, 10. Imagine what happens when you have a surgery. There is a cut directly into your body that goes pretty much quite deep in most cases. And as the fascia starts to heal itself, it is not coming back into its natural state of being fluid, open, and elastic. It actually creates those thicker bands of collagen, that thick fiber that makes sure that there is protection on those areas that have been operated on. And of course, I'm not only talking about surgeries. Most of us, probably all of us, we've had some injuries. Things happened. You cut yourself deep into an area in your body. Scar tissue is created in the body constantly. It can also be an effect of internal infection, of inflammation. So what happens in the body when the scar tissue grows and creates those thick bands, those fibrous sort of attachments and bands and kind of thick cords in the body, the fascia gets sort of pulled out of alignment. And so with my fascia release and with the treatments that I'm teaching you, what we do, we really want to pay attention to all the areas that have scar tissue. And, if you look on the surface, you may just see like a little bit of an opening. Maybe you had a surgery, but it was an endoscopic surgery where the cut is just sort of like a thin tunnel into your body. It's not large, it's not expansive or extensive on your skin. So it's even hard to see it, right? But what we find that actually treating those areas can be singularly most effective for releasing chronic pain, tightness, restrictions, and the plethora of different issues that we suffer as human beings. So, of course, I have my bowl today. I'm not going to be demonstrating a particular technique. I just wanted to bring your attention to what you can do if you had a surgery. So let's imagine it's a very common situation when people come in looking for treatment or looking for self-treatment instruction, and maybe they had one or multiple pelvic surgeries. And by pelvic surgeries, I refer to C-sections, hysterectomies, any abdominal surgeries as well, when the scar tissue actually can go and wrap into the pelvis. For men, prostate cancer is such a big deal, so a lot of men had prostate surgeries or maybe radiation, which also creates the scar tissue in the body. So run through your history, think about it. What happened? Have I had any surgeries? You may not even remember. Sometimes we don't remember, which is a curious thing. I'm always wondering about that. So just be honest with yourself. Remember your story. Remember your history. And even if there's areas that you want to avoid in your body, actually, I would encourage you to go into them. Get a little courage. Ask yourself, well, why do I want to avoid that area? Maybe it is holding a lot of trauma from past experience, like surgery. So you will not hurt yourself. One thing I want you to remember, if you just had a recent surgery, you need to give it 6 to 8 weeks for the scar tissue to actually heal and close up. And then we can start treating it. But even with recent surgeries, you can just use sort of energetic pressure where you place your hand. See, imagine maybe I had a surgery on my other hand. So I'm just sort of softening, relaxing my hand and just sort of gently connecting, maybe even placing my hand very gently on that area of surgery with zero pressure. So this is something you can do for recent surgeries, just touching it with extremely light, gentle connection, no pressure whatsoever. But once your scar tissue heals, and maybe you have some from 20 or 30 years ago, maybe you had kids 40 years ago, and there is an abdominal cut from your C-section, then you can start using the ball, okay? And simple thing, as always, we find an area of thickness and tension in the body. We get on the floor or on the couch, or we sitting up. However, you can place yourself comfortably on the ball and just apply pressure. Say, I'm going to point my camera here. You can apply pressure. See, for example, if I had a C-section, I'm going to be applying pressure on my lower abdomen. And wherever you have that cut, wherever you have that indentation on the skin. So scan your body and ask yourself, where do I want to go today? Okay, so a best way to do that, if you start just sitting down and taking a few breaths. Let me kind of make yourself comfy here. So taking a few breaths. Letting the air out. Connecting with your body, maybe shaking it up a little bit. Rolling yourself a little bit. Letting go. And just ask yourself, is there a place of tightness? Is there a scar tissue that's calling my name and saying, hey, I want to get some treatment? And you know, a few of us who are lucky and haven't had any surgeries, you may wonder, like, how does that apply to me? Well, if you have no scar tissue in your body, which I think is wonderful, just apply pressure to any area that you feel thick and tight and restricted. It may be somewhere around your hips, or somewhere around your belly. Maybe it is around the back. So just the same thing, you know, you don't have to go into scar tissue. If you have scar tissue, I would suggest that you treat that. So again, let's take a deep breath. Relaxing, releasing, going deep into the body, connecting. And just asking yourself, where does my consciousness is? Where is it going right now? Where is it pointing me to? Right now, what I felt is a connection right into my diaphragm. So I don't have any scar tissue here, but a lot of people had scar tissue around the belly. Even with endoscopic surgery, you may have that minimal little teeny dot, but don't discard it. It's very important. You actually can get progress by treating those areas exactly, because that little teeny scar is a tunnel all the way deep into your body. For example, if your gallbladder was removed, the camera lens and the surgical tools had to go all the way from that little teeny point on your belly all the way deep, deep, deep into where your gallbladder was to remove it, right? So don't just think of the skin. Think of what is underneath the skin, what is underneath that surface level. Think globally, deeply. ask yourself, where may I have scar tissue? And also just go with your intuition. If maybe you decide not to treat the scar tissue but another area, that is good. So once you go through that little 1 minute or 2 minute connection with your body, breathing and asking yourself, where do I want to go? Then pick that spot and use your ball and just get on it. And again, same principles always. You're going to be softening and releasing into the pressure, breathing, and then staying at it for at least 5 minutes, right? So remember the 5 minute rule and not forcing. And as movement kind of gets initiated in your body, go with the movement, let yourself unwind. If not, stay still. If emotions come up or sensations, breathe and let them go. You can always journal after. And one more step to this, what I would love for you to do is once you're done with that connective little teeny micro meditation, I want you to write down the areas that came up for you. Write down the scar tissues that you may have and make a plan that in the future you'll be treating them, even if you are not drawn to it, even if you're not feeling anything there. It's an awesome way to self-treat, to go to places that maybe are discarded and not paid attention to because they don't hurt. But this can open this entire new universe of connecting with your body and bringing back areas that have been sort of outside of our awareness and consciousness back into awareness. And from there, you start to connect deeper and deeper into your body. So do your practice, play around with that, listen to your intuition, and I'll see you tomorrow. Okay? Have a beautiful